Imagine this: you book a dream vacation, a relaxing cruise to escape the everyday, only to return home to the chilling news that you might have been exposed to a deadly virus. This isn't a scene from a Hollywood thriller, it's the stark reality unfolding across America right now. Several states are on high alert, actively monitoring residents who were either on a specific cruise ship or had close contact with those who were. The specter of hantavirus, a disease notoriously difficult to contract but terrifyingly dangerous when it does, has suddenly become a very real and present threat. Before we dive into the details of this unfolding situation, if you want to stay on top of everything happening in US politics and how it impacts your health and safety, hit that subscribe button right now and leave a like. It really helps this channel grow and allows us to keep bringing you this critical information. So, what exactly is going on? The Centers for Disease Control and Prevention, or CDC, has confirmed that a hantavirus outbreak has been linked to a recent cruise ship voyage. For those unfamiliar, hantaviruses are a group of viruses that can cause severe respiratory illness, often referred to as hantavirus pulmonary syndrome, or HPS. The primary way humans contract hantavirus is through contact with infected rodents, particularly deer mice, and their droppings, urine, and saliva. However, in this alarming cruise ship scenario, the transmission route appears to be more direct, raising questions about hygiene protocols and the enclosed environment of a ship. The key here is that several states have either confirmed their residents were aboard this particular cruise ship or were otherwise exposed to the virus through contact with returning passengers. This means the potential for local transmission is not hypothetical, it's already a concern for public health officials across the country. We're talking about states that are now actively trying to trace the movements of these individuals, identify potential close contacts, and implement necessary containment measures. The implications are significant. Hantavirus symptoms can mimic the flu initially, making early diagnosis difficult. These include fever, headache, muscle aches, and chills. However, the illness can rapidly progress to severe shortness of breath, dizziness, and, in many cases, a grim prognosis. The incubation period can vary, adding another layer of complexity to contact tracing and public health interventions. It means that even individuals who feel fine might be unknowingly carrying the virus. Who is most affected? Primarily, it's the passengers and crew members who were on that specific cruise. But the ripple effect extends to their families, friends, and anyone they may have come into contact with after disembarking. Furthermore, the intensive monitoring and potential quarantine measures could impact communities where these individuals reside. This is a public health crisis that requires swift and coordinated action from federal agencies like the CDC, state health departments, and local authorities. What are the possible outcomes? The worst-case scenario is a widespread outbreak, with hantavirus cases popping up in multiple states, overwhelming local healthcare systems. This would necessitate significant public health campaigns to educate the population, reinforce preventative measures, and encourage prompt medical attention for anyone exhibiting symptoms. On the other hand, if the contact tracing and isolation efforts are successful, the outbreak could be contained, limiting the number of cases and preventing a broader public health emergency. However, this situation also shines a spotlight on broader issues within the travel and cruise industry. It raises questions about the effectiveness of health screenings, sanitation practices on board large vessels, and the preparedness of these industries to handle infectious disease outbreaks in an increasingly interconnected world. We saw this with other outbreaks, and now hantavirus adds another concern to the list. The government's response, particularly from agencies like the CDC, will be under intense scrutiny. Their ability to swiftly identify the source of the outbreak, provide clear guidance to the public, and support state and local health departments will be crucial. This isn't just a health story, it's a story about governance, public trust, and the complex interplay between individual actions and collective well-being. As political leaders weigh in and resources are allocated, this situation will undoubtedly become a focal point in national discussions about public health infrastructure and emergency preparedness. So, what do you think about this? Should cruise lines face stricter regulations to prevent such outbreaks? Drop your opinion in the comments below. I read every single one. The vigilance of public health officials and the cooperation of the public are our strongest defenses in this fight. Stay informed, stay vigilant, and we'll continue to bring you the updates as this story develops.